All right, so we've got one of our post-op patients here, and I just wanted to share her experience. You can tell me your name.
Christine.
All right, Christine. So can you tell me about how your pain was before you had any of our intervention and surgery?
So my pain was constant and continuous. It average was 5 or 6, and it would go up to a 7 or 8 every couple weeks. I really didn't have any relief from any medical drugs or pharmacy. I would get nerve blocks every now and again, and I'd get about 2 weeks worth of relief. So I had doctors who really didn't know how to help me, how to treat me, how to help me with my pain or get me some improvement in my quality of life.
And what about other symptoms that you had besides your pain?
So I had other kind of weird symptoms. I lost my balance. I could barely walk down the street to get the mail without, putting my arms out for balance and support. There were times where I was using a walker to walk because I just couldn't stand upright without losing my balance or needing a wall or something to support myself. I had pins and needles down my arms, sometimes down my thighs, and then my vision had kind of deteriorated, so I needed my glasses full time.
And so do you know the surgery that you had done?
I had occipital nerve decompression surgery.
All right, and so you had that done for your greater occipital nerves, and you had your lesser occipital nerves divided, and your third occipital nerves divided, and that was when?
That was March 19th, so
and
just shy of 2 weeks tomorrow.
All right, so can you talk about what's been happening since then?
So I actually feel like myself again. I have some energy. I can walk. I can balance on my heels, which I haven't been able to do in 3.5 years. I can walk. I walked 3 miles the other day, which has been over 2 years since I've been able to do that. No support, no balance issues. I can see my phone again without my reading glasses, which is great. I don't have the pins and needles down my arms and legs anymore, so I actually feel like me again. Like I have hope that I can go conquer the world again.
Oh, that's awesome. We were hopeful that these secondary symptoms would improve. Never sure, but that's awesome. And your pain?
My pain is minimal. There's some tightness after the surgery, maybe a little post-op pain, but very minimal. I don't need to take any Tylenol or anything else to manage it.
So you're not on any pain meds at all anymore?
No pain meds.
All right. And anything you'd say to people considering surgery, or?
I think if you're considering it, take the plunge, take the challenge, go get a consultation, go find out if it's the right treatment for you. I exhausted everything else that I could, and it took me a few months to bridge that gap to say, yes, I'm going to go get the consultation. It's scary because you don't know if you're going to get a yes or a no, and I had so many no's of nobody knowing how to help me. So that was a little scary to take that plunge to get the consultation, but I haven't looked back. I'm super excited that I did it. Very supportive family, and I couldn't say anything more about it. I'm very happy that I did it.
You want to be in this video, supportive family?
He doesn't. He's shy.
No? All right, we got supportive family over here by the side, but all good. Well, I can't tell you how happy I am to hear that you're doing so well, and I really appreciate your input here. And lastly, tell me what were we just talking about? What's your plan to try and do this summer?
So before all this happened, I was running 5Ks, 10Ks, and obstacle course races. So I want to go do another one this summer, but yeah. We'll see how the training comes.
I have no problem with you doing it, so that's all good. All right, thank you so much, and I'm really glad you're doing well.
Thank you.